Now, Dr. Mills, I want to bring you back in the conversation. Here at WGME 13, we're not taking sides on this particular discussion, this debate. But on the national level, there's been a lot of concern about vaccines, particularly MMR and alleged relationship to autism. Can you address that issue? Because that's what one of the concerns that many people around the country have.
Well, first of all, I want to say I do agree with Meryl Nass, Dr. Nass, in that we do need a lot more research in terms of what causes autism. We know, even in my years as a pediatrician, I mean, I've seen a lot more children and know of a lot more children with autism than we ever saw 25 or so years ago. But I also believe that it's been very clear that vaccines are not causing our autism epidemic. That has been shown over and over again by a number of studies, and a very credible international organization called Autism Speaks. Many of you probably have heard of this organization. They have come out, they've done a thorough look at review of all of the studies, and they have put on their website, Autism Speaks, that there is no connection between vaccines and autism, that they do not see a link between the two.
I vociferously disagree with that opinion. We have actually on our website, we have a list of 99 research papers that do link vaccines and autism. And the reason this is still a question is because the liability protection that I mentioned earlier, that parents cannot sue for vaccine injury, there really is no forum. You know, the forum in the U.S. that we determine these questions is civil court. Because there's not been a vaccine injury case in front of a jury in 30 years, no family can get in there with our research to say, you know what, there is a link, and not even the most of the evidence now shows that there is a vaccine link. The other problem that parents have with the research that's being cited is that the CDC is currently under a congressional investigation for fraud in these matters. And there will be hearings in 2015 on after William Thompson, one CDC whistleblower, turned state's evidence and has, or he turned whistleblower and has turned over thousands of documents to Congress saying he participated in hiding vaccine links on the MMR from the public.
And Dr. Flanagan, I'm going to put you in the spot for just a moment because Ms. Taylor mentioned something about court cases, but there's federal law. There's the National Vaccine Injury Compensation Program. That's the mechanism that's currently set up to address the concerns that people have about alleged or actual injuries or illnesses or problems resulting from vaccines. Are you able to address that a little bit?
Yeah, there's two distinct points, and one is, did you violate standard of care? Or was someone liable for an outcome? That is something you settle in the courts. Is something effective? Is it medically appropriate? Is it standard of care? That is settled in the medical literature through research, and you can't mix the two. You'll never get good answers and appropriate long-term decisions about what is right or wrong for people and for populations.
We're back to the live audience. Please tell us who you are, where do you live, and what is your question?
My name is Holly Hagan Austin. I'm from Rangeley. And my question is, as a child, as a parent of a vaccine-injured child, I believe all four on the panel today have heard my son's story, but regarding within hours of a 6-month vaccine seizures, after a flu vaccine, regardless of being on anti-seizure meds, he had several more seizures. It wasn't until his 15-month vaccines, I said to the doctor, I don't want to do anymore. And I got his finger and a pen in my face and said, if you don't do these vaccines, your child could die from them. I gave in. He got some vaccines, a DT vaccine with the full dose of thimerosal. And within days, he wasn't himself. Within 2 weeks, he stopped talking from a normally developing child into a child who meets the criteria for autism. And what are we doing as healthcare providers to identify that, yes, there are vaccine injuries, and yes, you should have a choice on vaccinating your other children? I hear people saying it's not the vaccines, but what does cause the neurological damage that we see in this huge number of children now diagnosed with autism?
Dr. Mills, certainly there are exemptions for religious and philosophical reasons, but there are also medical exemptions. Would this have been the type of case that might have qualified for medical exemption for certain vaccines?
You know, I can't really speak specifically to this situation, which sounds quite tragic, really, but I don't know. What I do know is that, because I can't comment on the specific situation, but because I don't know her son, but what I do know is that there is a big system across this country in terms of assuring vaccine safety. There is the VAERS, which is the Vaccine Adverse Events Reporting System, where anybody anybody, a parent, a physician, anybody can report to this system if they feel that somebody has been vaccine injured. And that is used, that reporting system is used to look at reports from across the country, and then the CDC, the NIH, the FDA all look at those reports, and they work in collaboration and partnership with 9 healthcare systems around the country to look at data to see if there are any other reports being seen. So if they see an increase through the volunteer reporting system, then they look to these 9 different healthcare systems to see if they see any similar increase in reports in any people with adverse events from vaccines. And then on top of that, there is another collaboration with 7 of the top research centers around the country, including Johns Hopkins, including Vanderbilt and Duke and others, where they do research in collaboration with NIH and CDC. So they take the reports from the voluntary adverse reporting system. They look at the healthcare data from those 9 healthcare systems, that's real-time data, and then they look to see what the questions are that are unanswered and what kind of research needs to be done. So there is not another medication or drug that I know of that isn't so overseen and studied as vaccines are here in the United States. And it's a real exemplary system of private and public collaboration with a number of different federal agencies, including NIH and CDC and FDA, to assure that our vaccines are as safe as they can be.
Dr. Nass, according to the Centers for Disease Control, in the 2012-2013 school year, out of about 4.2 million kindergartners, there were just over 91,000 exemptions across the entire U.S. from getting vaccinations. That's about 1.8%. Some people would say a 98% rate is actually a pretty good rate. So are we quibbling over relatively small numbers that really aren't that significant?
Yes, I think we are. The rate of vaccine failures is actually higher than the rate of people who are getting exemptions and not being vaccinated. So, for example, in the United States, there have been several measles epidemics in which the majority of the people who got measles were actually vaccinated, and in some cases vaccinated twice. There was an epidemic in Canada a few years ago where the majority had been vaccinated twice. So the problem is, yes, you would have pretty good herd immunity if vaccines were 100% effective, but many of them are 80% effective. The flu vaccine, and I looked at CDC's numbers a couple of days ago, averaged them for the last 10 years, 40% effective. Other people say less. So you're not going to get any herd immunity if your vaccine is 40% effective. But let me say, on the other hand, in the entire Western Hemisphere, including Haiti, one of the poorest countries in the world, there is no endemic measles, rubella, ma'am, or mumps. So the cases come in from outside, they come from other countries, they're brought in, we have small epidemics, and then they end. You know, we haven't had more than 1,000 cases of measles per year in this country for 15 or 20 years. There has not been there's not been one person in the United States who has died from measles since 2003, 12 years ago. So we're talking about a very small number of people, and we're talking about a very large number of vaccinations. So to compare the risks and the benefits from vaccinating your whole population for a small number of cases, you have to know what is the benefit, what is the risk. And in the case of vaccines, we don't have very good data to figure out what the risk is. We have lots of stories of children who got very ill or after a vaccine. I mean, I talked to somebody tonight who was telling me about the big red ball he got after a pneumococcal vaccine, which is pretty common. You know, but we don't consider that a serious reaction. It goes away after a while. It increases inflammation. However, now everybody who comes into the hospital with a heart attack or pneumonia or anything, if you're over 65, you get a pneumococcal vaccine, which increases the amount of inflammation in your body, and no one is measuring whether that's harming people. No one knows whether that is making your heart attack worse or your pneumonia worse, to increase inflammation while you're already suffering from a severe and acute inflammatory disease. So these are questions that need to be addressed. Dora did talk to you about multiple systems in the United States for assessing vaccine safety, and they exist, but they don't always work. I'm an expert on anthrax vaccine. I've testified before several congressional committees on anthrax vaccine, and I can tell you there are over 7,000 vaccine adverse event reporting system reports on anthrax vaccine, talking about all kinds of terrible illnesses, and FDA and CDC have said, you know, they don't mean anything because you have to do this can only give you a signal, and then we have to study the signal to see if it's meaningful, and guess what? We don't think any of this is meaningful, so we're not doing those directed studies.
I want to bring Dr. Flanagan back in the conversation, and this goes back to comments that Dr. Nass made, but also our first audience member question about this. There are so few examples of some of these viruses and diseases that once upon a time were rampant in this country, or maybe rampant's not the right word, but were more widespread. Are we quibbling about small numbers because we've had such great success in batting down these diseases and these infections and these afflictions because of vaccinations?
Well, the fact that we have small numbers today when you have epidemics elsewhere in the world tells you that vaccines are effective. And it has worked. It has protected children in America from getting horrible long-term chronic conditions, from passing away. You know, we used to have fatal diseases like polio, like pertussis, where children would cough until they couldn't breathe, and then they would die because they couldn't breathe. And this doesn't happen in the world today, at least not in the Western world. And so what you're hearing is a testament to the efficacy of the vaccine. Now, can safety be improved? Is quality the best it will ever be? Of course not. The medical system has never said that it's reached the highest level of quality and perfect efficacy in anything. In medicine, we always strive for improvement, and we'll continue to do so.
All right, we're back to the live audience, and after I get this young lady's question, we're going to check in with our social media desk to find out what's happening with our viewers at home. In the meantime, please tell us who you are, where are you from, and what is your question?
My name is Elizabeth Shardlow, and I live in Auburn. And my question is for Dr. Flanagan. In your medical education, or in the 22 years since you received your doctorate, did you receive any education or training on conditions that are contraindications to vaccination? For example, autoimmune disease, mitochondrial disorders, or methylation defects, or family histories of these conditions? As a pediatrician, did you ever suggest an alternative vaccine schedule for any patient, or recommend that a patient not be administered a particular vaccine? If so, why? And before I have you answer that, if you have not, what is a parent to do with the average of 12 minutes that they get with their pediatrician to make that educated decision to vaccinate their child with a specific vaccine or not, based on some of those possible contraindications to vaccination?
And doctor, please don't ask me to repeat that question.
Look, parents in particular and patients in general have got to have a trusting relationship with their provider. And if 12 minutes or 20 minutes isn't enough, then demand more. I always gave my patients whatever volume of time they needed in order to have an understanding in what their concerns were and where I thought I could educate them, where I could advocate, and where we could come to agreement. So, no, not everybody who lived in the Pittsfield area felt that I was the pediatrician for them. And there were plenty that chose to go elsewhere. And so I encourage families today, I encourage families back then, find the provider who can meet your medical needs within your value system and then move forward from there. But don't let a provider browbeat you into doing something you don't wish to do. To your original question, in private practice, I had these conversations. I can't get into the details of the conversations because it's protected health information and confidential. I can't get into the decisions that were reached, but I can tell you parents didn't always reach the decisions I would have reached.
You had a quick follow-up?
I did. Back to my original question, did you ever receive any training on how to identify contraindications to vaccination, such as autoimmune disorders, mitochondrial defects, and methylation disorders?
So yes, you receive that training during your schooling. You receive that training because, I don't know if you know, but when you finish medical school, unknown to me, you're uniquely qualified to do nothing. You have to go into a training program. So for those who are naive like I was, think hard. You then do a 3, 4, 7-year training program. And even when you're done, you have to continue your education in order to maintain your license and your certification. So yes, we all continue that. For those who are in pediatrics, for those who do family practice, for those who provide services to children, a key part of that is continuing your education around immunizations.
Before I go to Dr. Nass, I want to bring Ms. Taylor back in the conversation. As you've looked at this issue, is there other training that you might recommend as someone who examines this issue that perhaps the medical field should undertake, as our audience member has addressed?
Yes, there's a great deal. And actually, I've written a bill that's in the Maine legislature now called the Maine Vaccine Consumer Protection Program that would actually get doctors in Maine appropriate training from federal guidelines on vaccine injury. It's kind of frustrating to hear Dr. Flanagan's answer because when you actually kind of sit down and spend time reading package inserts, reading the federal guidelines on vaccine injury and how to diagnose it, and then start asking questions of your pediatrician, it's rare to find a pediatrician that actually knows as much as you do. And I had the unusual experience of, I had a meeting with some parents and Dr. Flanagan 3 years ago, and we pulled up the federal vaccine injury table and read to him the diagnosis for how you diagnose brain injury that's induced by a vaccine, and he'd never read it before. And we had a long conversation about it. You know, parents shouldn't have to educate public health officials on federal guidelines for vaccine injury, and that's what's happening. So both if parents want to understand more, they can look up the Vaccine Injury Compensation Program and read their injury table. We always encourage parents and physicians to get to know the vaccine package insert. There's a lot of information on there that parents don't really know and doctors may or may not know. And we want to codify that in law, that doctors really need to know federal guidelines and package inserts. And again, the information that's going into the VAERS database, it kind of stays there. Nobody goes back to Holly and says, okay, you reported this, we've investigated, here's what's going on with your case. It's just a one-way information vacuum, and that information does not go back to the states. One of the things that parents have been asking for is the Vaccine Injury Compensation Program has paid 4,000 cases of vaccine injury to the tune of almost $3 billion now, and we have a huge library of information from these cases that could be telling us, okay, here's the kids that have vaccine injury. Here's the kid that got sick after. How do we use this to prevent injuries from going forward? And we don't get that information.
And I want to bring Dr. Nass back in the conversation. I have to check with our viewers at home, and of course, I want to bring our media partner back into the conversation as well. So, but a quick comment from you, Dr. Nass.
Yes. Well, I don't remember more than about half an hour on vaccines in my entire 4 years of medical school, and certainly there was no training. Now, I'm not a pediatrician, I'm an internist, but no training at all about vaccine injuries, and I've had to sort of learn it myself. It's a very, very limited area which very few doctors know about, and I get contacted weekly by people from around the country who believe they were injured by an anthrax vaccine, who beg me for doctors that they can go see, and I don't know any doctors they can go see.